Hello my friends, good afternoon. This is Dr. Kazmi and you're watching my YouTube channel. So let's suppose we are given a scenario in which a child has got a mild upper respiratory tract infection. He's got fever and some, let's say, upper coryzal symptoms, and then within 4 or 5 days he goes downhill and starts to have seizures, and suddenly has developed altered mental status, and he is hospitalized and is getting seizures again and again, which are not controlled by typical anti-seizure medications. So we call this situation as acute encephalopathy. So if a child is presenting with acute encephalopathy after a trivial or a minor infection like a URI, then how to proceed in such a scenario? Remember, there are 5 broad differentials if a child presents with acute encephalopathic features after a trivial infection. Now, the first thing is that the first category is what we call as acute metabolic encephalopathies. Now, acute metabolic encephalopathies, though they usually have some history of metabolic disturbances in past, but sometimes if a child has got a condition in which there is a sort of a subclinical deficiency of the enzymes, then usually they are quite normal. So they do not present with the typical features of what we call as metabolic illnesses, but they can become decompensated after a minor illness. And they can present with with encephalopathy. So you should be thinking of Rice syndrome. You should be thinking of some other enzymatic deficiencies. But usually in these cases, the LFTs would be abnormal. The blood sugar will be low. You might find an elevation of lactate in the blood. So the first category is acute metabolic encephalopathies. The second categories are toxicologies or toxidromes. So you have to suspect some form of toxicology, which can be one of the differentials in these conditions. And what happens is that if somebody has taken cocaine or somebody has taken some other drugs, they can also present with altered mental status and seizures. But usually if you do a toxicology, there will be something positive in such a scenario. The third broad differential is what we call as acute disseminated encephalomyelitis. Now, this is usually a demyelinating disorder, can be triggered by some viruses like cytomegalovirus or Epstein-Barr virus. So what happens within a few days after an trivial infection, there is a sudden demyelination in the central nervous system as well as the peripheral nervous system. So the child would develop seizures, would develop altered mental status, would develop either hypertonia and hypotonia, and they usually do not respond to normal anti-seizure medications. You have to give IV methylprednisolone or IV immunoglobulins, plasma exchange, etc., etc. The fourth category is acute viral encephalitis. So Japanese encephalitis virus, Nile encephalitis virus, herpes simplex encephalitis, they can also cause acute encephalopathy. The fifth is what we call as autoimmune encephalitis or immune mediated encephalitis like Hashimoto encephalitis and posterior reversible encephalitis. Now, these types of conditions are usually associated with autoimmune conditions. So if there is a history of some problems with the thyroid or the joint pains, or like conditions like SLE, and all of a sudden they develop acute encephalopathy picture, then you should be thinking of what we call as immune mediated encephalitis. So these are the 5 categories of a child who is presenting with acute encephalopathic picture after trivial infection, and what are the broad differentials. Thank you.